Hi, hello. Today I am here with a new topic that is Dequervain tenosynovitis and Dequervain syndrome. Then we will see what is Dequervain syndrome, what are the clinical features, what are the causes, what are the management. Dequervain syndrome is named after Swiss surgeon Fritz Dequervain, who first described the condition in 1895. It is a stenosing tenosynovitis which affects the tendencies of the first dorsal compartment of the wrist, like extensor pollicis longus, extensor pollicis brevis, abductor pollicis longus, and is characterized by degeneration fibrosis of the tendon cyst, mainly inflammation of the extensor abductor tendon of the thumb caused by repetitive use of the thumb. Okay, in this slide we will know what are the anatomy of that. So, in dorsal aspect of the wrist contains 6 compartments that transmit the tendon to the hand. In first compartment, abductor pollicis longus, extensor pollicis brevis. Second, extensor carpi radialis longus, extensor carpi radialis brevis. In third component, extensor pollicis longus. In fourth component, extensor digitorum, extensor indicis. Fifth component, extensor digit minimi. In sixth component, extensor carpi ulnaris. So, the first dorsal compartment is approximately 2 cm long and is located over the radial styloid proximal to radiocarpal joint. Okay. What are the predisposing factors? Overuse injury, repetitive tasks that involve overexertion of thumb, radial and ulnar deviation of the wrist, arthritis, and pregnancy. These are the predisposing factors. Okay. Then what are the clinical features? First, we'll see wrist pain on the radial side, difficulty with grasping and gripping, and swelling at the radial styloid process. And whenever we'll do palpate, that pain at the site of retinaculum at the radial styloid. Okay, so we'll go next slide. Um, if we are not giving treatment, okay, what is happening? So the friction induced tenosynovitis can progress to stenosis tenosynovitis. Okay, that that will form to fibrosis and loss of flexibility of the thumb in flexion. The specific test is there, that is Finkelton's test. That thumb is put in the palm and enclosed by the finger, and the wrist is then up deviated ulnarly. If pain at the radial side of the wrist, that is the positive sign of the Finkelstein test. In this slide, we'll know what are the differential diagnosis. So, first one is scaphoid fracture, second one is tendon rupture, then is radial nerve neuritis, then basal joint arthritis like CMC joint of the thumb, then rheumatoid arthritis. These are the differential diagnosis. Then we will know what are the intervention. Okay, what are the goals of the intervention? To reduce inflammation, to prevent adhesions from forming, to prevent recurrent tendinitis. Okay, so in medical management we have to do corticosteroid injection into the fibrosis of the first dorsal compartment, and NSAID. um, so here, rehab protocol after decompression for Dequervain tenosynovitis. In 0 to 3 days, depending on the physician, the patient may initially immobilized in thumb spica spring motion. Should be encouraged in IP joint of the thumb and other free digits. Surgical dressing removed in 2 to 3 days, and encourage tendon gliding exercise, gentle active motion exercise of the wrist and the thumb 3 to 5 times daily. In 3 to 14 days, motion exercise and sutures are removed approximately 10 days after surgery, and split may continue. And yeah, in 2 to 4 weeks, active range of motion exercise and modalities. In 4 to 6 weeks, modalities and isometric strengthening exercise of the thumb. Okay. So what is the OT management? Okay. So first we have to give some activities for pain relief, heat and ice application we can use. Then we have then range of motion activities. Okay, then strengthening activities, then some ergonomic advice like if they are working in IT sector, we can activity modification we can do. Then according to biomechanical rehabilitative framework preference to restore range of motion and strength endurance. These are some rehabilitation exercise like opposition stretch, wrist stretch, wrist flexion, wrist extension, finger spring, grip strengthening, wrist radial elevation, strengthening. So in prognosis, patients who receive treatment within 6 months of developing the condition have an excellent prognosis. 90% of non-severe cases may expect relief from conservative management. Okay, this much only. Thank you for your patience. Please one subscribe and one like.